Welcome back to the Deep Dive. Today we're diving into something pretty fundamental for physiological wellness,
Yeah.
how you maintain strong erection quality and, well, overall sexual health across your lifespan.
Yeah, it's a huge topic. And what's really interesting about the research we looked at is how it shifts the focus. It's not just about, say, checking hormones in isolation.
Right. It's about the harmony, the correct function of all your systems together, hormonal, neuronal, even gastrointestinal. It's all connected.
Absolutely critical. When we talk about sexual health, it's broader than just avoiding erectile dysfunction or ED.
hmm
We have to consider the whole thing.
Yeah.
Libido, that sexual impulse, even the quality of orgasm. Now, sure, conditions like diabetes, really out of whack lipid profiles, or severe testosterone deficiency, those are known causes.
Yeah, the standard stuff.
Exactly. But our deep dive today, it looks somewhere else. We're focusing on 6 key lifestyle and sort of environmental factors that the research really flags.
Okay, so we're kind of providing the shortcut here, getting past maybe the most obvious medical causes and looking at these 6 interconnected factors, things you can actually do something about for long-term function.
That's the plan. Our mission really is to unpack these 6 things related to nutrition, metabolism, stress. Stuff that often flies under the radar but is actually fundamental, not just side issues.
I got it. Where do we start?
Let's kick off with factor number 1, correct body composition.
Okay, body composition. Let's unpack this. The research talks about something called the aromatization trap. What's that about?
Right. So the trap is basically having a high percentage of visceral fat. That's the deep belly fat, often combined with losing muscle mass as people age or become sedentary.
Okay.
And this combination, it isn't just passive. That fat, it acts like its own little endocrine organ. It ramps up something called aromatization.
Aromatization, that's the conversion process.
Exactly. It's where your body converts testosterone into estradiol, which is, a primary female hormone.
Whoa, hang on. So does that mean a guy could have, like, a high total T-score on a blood test,
Yep.
but still be in trouble because his body fat is just converting it all away?
Yeah.
That seems like a huge blind spot.
It really is a critical point. Even with high testosterone, if that ratio of estrogen to testosterone gets too high because of this constant conversion, well, that's where problems start.
What kind of problems?
Significantly impacts libido, that drive, and the sexual impulse itself. But mechanically speaking, high estrogen really hampers the cavernous muscle's ability to dilate properly. You need that dilation for a strong erection.
So the fat is like a hormone factory working against you, sabotaging the mechanics.
Yeah.
And the research mentions other things too, right? Like gynecomastia.
Yeah, breast enlargement in men, fluid retention, even effects on blood pressure and the prostate. It's all linked back to that high estrogen state driven by visceral fat.
So the takeaway is pretty clear then. Control the belly fat, keep the muscle. Super important.
Absolutely vital. And that leads us pretty neatly into factor number 2, correct nutrition. It's tightly linked to the first one.
How so?
Well, think about it. Being sedentary, eating a lot of high-calorie stuff, especially refined flours and sugars, that drives up insulin, leads to hyperinsulinemia,
Right.
which in turn contributes directly to that abdominal fat we just talked about, and also fuels systemic inflammation. So that's the problem of having too much.
Okay, that makes sense. But here's where I thought the research got really interesting. It also talks about the opposite problem.
Ah, yes. The danger of a prolonged caloric deficit.
Exactly.
Yeah.
And it's not just about crash dieting, is it? It could be chronic anxiety killing your appetite, or maybe just consistently skipping important meals.
That's right. When you're in that deficit long term, you start lacking essential building blocks, fatty acids, amino acids, key micronutrients.
And that causes problems how?
Well, it messes with your insulin sensitivity, for one, but crucially, it starves the system of what it needs for proper vasodilation, that widening of blood vessels in the penis.
Ah, so it's another mechanical issue. If the blood vessels can't open up properly?
You can't get the blood flow you need. The research is pretty explicit. This state impacts testosterone release and stops the cavernous bodies from expanding fully.
Wow, so it really is a dual-edged sword.
Yeah.
Too many calories, metabolic damage. Too few essential calories, deficiency, and mechanical failure.
Precisely. Which brings us very naturally to the third factor, the quality of your training.
Okay, exercise. We know it helps with body composition, insulin sensitivity, linking back to the first 2 points.
True. But there's a specific neurochemical link here that's often missed, a real aha moment in the research.
What is it?
It's not just any exercise. The sources really hammer the importance of regular strength training, lifting weights, maybe 2-3 times a week.
Why weights specifically?
Because that kind of loading, it stimulates the neuromuscular junctions, the communication points between nerves and muscles.
Well,
And doing that elevates a key neurotransmitter called acetylcholine, or AC here.
acetylcholine. I know that's important for muscle function, preventing things like sarcopenia.
Yes,
But
established benefits there, and for neurodegenerative conditions too. But what's less known is that ACH is absolutely crucial for getting strong erections. It helps transmit the nerve signal needed to kick off that vasodilation process.
So lifting weights is like a natural booster for the nerve signal needed for an erection. That reframes weight training quite a bit, not just vanity.
It's physiological support, a mandate almost. Okay, now for number 4, this one can be tricky. Stress control.
Stress. The great saboteur, as they say. We all feel it. Intense work, relationship breakdowns, big life changes.
And that prolonged stress, whether it's physical or emotional, it triggers this huge cascade, a body-wide hormonal and neural, desynchronization. Everything gets knocked off kilter.
What happens hormonally?
It's pretty severe. Stress jacks up adrenaline and cortisol. These directly suppress testosterone. At the same time, you often see prolactin go up and dopamine levels drop.
And dopamine's linked to drive, motivation.
Exactly. So lower dopamine means less sexual impulse, and it really diminishes the quality of orgasm, too. It just feels less intense.
But the really direct hit is physical, isn't it? Adrenaline.
Yes. Adrenaline is a powerful vasoconstrictor. It clamps down blood vessels. Chronic stress keeps your body stuck in that sympathetic fight-or-flight mode.
Your body's ready to run from a tiger, basically,
Yeah.
not relax into intimacy.
Precisely. And this creates what the research calls a vicious cycle. If you're already stressed and then you feel pressure to perform sexually, that pressure itself adds more stress. The adrenaline spikes, actively working against the vasodilation you need. You get caught in this obsessive loop, performance anxiety builds, and the problem just gets deeper.
That obsessive loop that sounds horribly familiar for anyone who's experienced performance anxiety. Your brain is yelling, relax, but your body's screaming danger.
It's a physiological trap,
Right.
which leads directly to the danger zone of quick fixes.
Like pills, Viagra, Cialis.
Exactly. The research is clear. Those pills can work for the moment. They achieve the vasodilation externally, but they don't touch the underlying emotional problem, the stress, the anxiety.
And relying on them might even make the psychological side worse.
It can. It can lead to a kind of dependence, reinforcing the idea that you can't function without help, potentially tipping over into actual sexual phobia or panic attacks around intimacy.
Okay, so if pills aren't the long-term answer for stress-induced issues, what is?
Yeah.
Beyond just manage your stress.
The sources point to a couple of things. First, adaptogens. Things like maca, ashwagandha.
How do they help?
They seem to help modulate the body's stress response system, the HPA axis, kind of buffers that chronic high cortisol state. But honestly, the second point is often more critical.
Which is?
Professional psychological support, therapy. Learning to actually communicate feelings, navigate those temporary life stressors, a diagnosis, a job loss, that can be the most direct way to undo emotionally driven ED.
That sense. Dealing with the root cause. Okay, so that's stress. Factor 5 takes us somewhere different, a physical filter. Liver health. Why the liver?
Because your liver is your main filter and processing plant for hormones, especially estrogens. You need a healthy liver to chemically modify estrogens, make them water-soluble, conjugate them so your body can actually get rid of them.
So if the liver's not working well, estrogen builds up.
Exactly. And we're right back to the problems from factor 1, the high estrogen ratio, the impact on libido and erections.
And what gums up the liver, the research mentioned.
A few key things. Environmental hormonal disruptors, phthalates in plastics, BPA. Alcohol is a big one, obviously. But also, interestingly, training really hard while carrying a lot of body fat, that combo can create these estrogen surges the liver has to constantly deal with.
Are there signs to watch for? Blood work?
Definitely look at liver enzymes, your transaminases. But here's a connection people often miss. Creatine kinase, or CK.
That goes up after intense exercise, right?
Right.
Muscle damage.
Right. And if your CK is chronically high from really intense damaging workouts, it means your liver is working overtime clearing out all that cellular debris from muscle breakdown.
And that takes resources away from
From its other jobs, like modulating and conjugating estrogen. So if your liver is constantly swamped with clearing CK, your hormone balance can suffer as a side effect, and that can impact erections.
Wow, that's a really fundamental link. Liver overload impacting hormones. Okay, that brings us to the final factor, number 6. intake of specific medications.
Yeah, this is a crucial one. If you're dealing with ED, you absolutely have to talk to your doctor or specialist about the medications you're taking, especially if the ED started around the time you began a new drug.
What kinds of drugs are common culprits?
The list includes things like chemotherapy drugs, which can lower T levels directly, corticosteroids, some immunosuppressants, certain anti-inflammatories, various antihypertensives, and specific types of beta blockers.
But the research really focused on one particular class, didn't it? The 5-alpha reductase inhibitors.
Yes, drugs like finasteride or dutasteride, often prescribed for male pattern baldness or for prostate enlargement, BPH.
Okay, and how do they interfere? What's the mechanism?
So these drugs work by blocking an enzyme, 5-alpha reductase. This enzyme's job is to convert testosterone into a much more potent androgen called dihydrotestosterone, or DHT.
I thought blocking DHT was the point for hair loss or prostate issues.
It is, for those specific tissues. But DHT isn't just bad. It turns out it's also really important for nerve function, particularly related to sexual response.
How so?
DHT plays a key role in making sure the nerve impulse actually gets to the cavernous body in the penis effectively. It's part of the signaling cascade that tells the smooth muscles there to relax, allowing blood flow the vasodilation we need.
So by blocking DHT production with these drugs,
You can inadvertently disrupt that crucial nerve signal in some men. The research suggests this side effect, ED, might show up maybe 8-10 months, sometimes a year after starting the medication.
that's vital context for anyone on those drugs experiencing issues. So if you need the medication for your hair or prostate, but it's causing this, what's the solution?
It really comes down to communication with your doctor. It might involve adjusting the dose, maybe trying a different type of medication if one exists, or sometimes if the treatment course is short, maybe just accepting the temporary side effect. It's always a balance between the treatment goal and quality of life.
Okay, that covers the 6 factors. It feels like they all weave together.
They absolutely do. And if you think about the bigger picture, we're seeing rises in metabolic issues, hormonal imbalances, and just so much psycho-emotional stress these days. ED is often a downstream consequence of these larger trends. It's common, distressing, and really hits male self-esteem hard.
So if we group these factors,
Right.
maybe metabolic health with body comp, nutrition, training, then systemic filters like stress and liver function, and finally external things like medications, you have to address all angles.
That's a great way to put it. You need that holistic approach. By actively managing these 6 areas, lifting weights, controlling body fat, managing stress, supporting your liver, being mindful of medications, you're not just chasing one symptom. You're actually building a whole plan for better sexual health and better overall health at the same time.
It really is all connected, deeply connected.
Okay, so here's something to think about based on everything we've discussed. We saw, especially with factor 4, how powerful that mind-body link is, how emotional stress, that pressure to comply or perform, can literally shut down physical function, leading to that obsessive loop, panic, even phobia. And the research suggested communication, psychological support, basically giving yourself permission is key to breaking that cycle for stress-induced ED. So here's the final thought. If giving yourself permission to relax, or even permission to fail sometimes, can help overcome such a profound physical block like that, what other physical symptoms might lessen or resolve if we simply granted ourselves that same kind of permission more often? Something to mull over. We'll see you next time on The Deep Dive.